Hello, I'm Dr. Brent Gibson, and today I want to talk to you about another form of nerve testing, vibration sensation. So the idea when you're testing for nerves, there's multiple different uh, pathways through the nerve that have that carry different sensations and determine how well that nerve is functioning. If the nerve is malfunctioning, many of these are not going to function like they're supposed to. So today I want to talk to you about vibration sensation, which is usually the most sensitive. It's usually the first to present with peripheral neuropathy and is often poorly tested if tested at all. So the idea, we're going to use this model just because I don't have a good model of the foot that has skin and everything, but typically you're going to do the test around the tip of the toe. If you can't sense it there, you'll do it at the first metatarsal. Can't sense it there, you'll do it at the malleolus, basically at the ankle area, trying to facilitate this. The way this works is you're both supposed to just determine the amount of sensation that's happening through vibration. The most common way this is done is the tuning fork. You get the tuning fork going and you put it on the end of there and see if they feel it. The disadvantage of this is it's only a single strength, depending on how well that's vibrating. So better is a vibration meter that allows you to turn it up. And so most of the time when we do this test, we'll actually put a probe on the end of the toe. We'll turn up the power from 0 to 90 volts of power going through the vibration, and it tells you how much the vibration is happening. The idea is you should feel it if you have normal sensation around 7. And you will have some individuals that will be hypersensitive with peripheral neuropathy where they'll actually feel it at 3, 4, 5, which basically means their nerves are overreacting. A lot of times you will feel it between 7, and I usually say if it's not above 12, it may still be normal depending on the individual, but 7 is technically supposed to be the normal. So as you get above, you start moving up, you're actually able to document exactly where they start to feel the sensation. And most of the time, it'll be pretty significant and you'll be surprised. And then you test one foot, test the other foot, and they should be symmetric if in certain types of peripheral neuropathy. But if they're not, that can rule out some of the, for example, diabetic peripheral neuropathy is usually symmetric. If it's not symmetric, there are other causes that may be influencing this. And so it helps you determine what's going on. It's the quickest to present with peripheral neuropathy. It's also the slowest to resolve. So if you're improving their peripheral neuropathy, the vibration may be the last thing that improves, but it's important that you do test it. Vibration sensation is a valuable tool in determining if you have peripheral neuropathy and the extent of your peripheral neuropathy, because you can put an exact number on it. This is Dr. Grant Gibson, and this is your Neuropathy Nugget Day 251. Vibration sensation as a way